Hi there, I'm Dr. Myrdalis Diaz Ramirez, and this is the Design Your Physician Life podcast. Welcome to this episode brought to you by our Maxillary Mastermind, an exclusive mastermind for physicians who want to learn entrepreneurship. Today, we have a wonderful guest, Dr. Eddie Ortiz, from the Community Healthcare Leaders in Puerto Rico. We have a great conversation with Dr. Ortiz about designing a medical career in Puerto Rico. Are you ready? Let's go.
Welcome to the Design Your Physician Life podcast, where you will get excited about being a physician, learn the tools that can help boost your success, and great tips from successful doctors. Join us to unlock the keys to an amazing physician life. And now, here's your host, Dr. Myrdalis Diaz Ramirez.
Hey guys, today I have a very special episode. It's very close to my heart. Today we have the wonderful Dr. Eddie Ortiz. He was actually one of my classmates in medical school, and this is what makes it so special today. He was born in Comerío, Puerto Rico, a small rural town in the mountain centers of the island. Dr. Eddie Ortiz obtained his bachelor's degree in biology from the University of Puerto Rico, like me, and then Doctor of Medicine in the same school, like me, yes. And then he went on to family medicine from the University of Puerto Rico as well. As part of his professional career, Dr. Ortiz spent almost 20 years providing direct patient care as family physician. He entered the administrative world in 1999 as medical director of the federally qualified Community Health Center. Most recently, he was CEO responsible for the operations and business development of a management services organization in Puerto Rico with delegated roles for a large delivery system, including provider network management, credentialing, recredentialing, contracting, claims management, and risk adjustment, among other functions. All those things that we as doctors love, right? Yeah. Previously, Dr. Ortiz served as Vice President of Medical Affairs for a healthcare system responsible for the corporate, clinical vision, and quality programs to ensure effective care to nearly 600,000 beneficiaries throughout the island. Prior to joining this MCO, Dr. Ortiz served as a medical consultant and has held executive positions in several provider and healthcare organizations in Puerto Rico and the United States. He's now the founder and CEO of Community Healthcare Leaders, a strategic consulting firm in healthcare, and he's married to the wonderful Diana Nieves, a healthcare administrator, and he has two children, Giovanni and Diana Imar. He enjoys painting in acrylic and oils. So, Eddie, I'm so excited to have you here, and it's a wonderful opportunity. I'm very honored to have a colleague and a classmate who has done so much in medicine. You know, we are going to be talking today about all the wonderful things that you've done for medicine, for all these companies that you work for your patients, for physicians in Puerto Rico. We're also going to get into your painting career. Right now, you guys cannot see it, but he's sitting in front of a wonderful painting. He's a wonderful Puerto Rican painter, and we're going to get there. But first, let's talk about when you got your inspiration to become a physician. You know, like, was it little Eddie, the teenager, the teen Eddie, or was it in college later in life? Tell us about what inspired you to become a physician, and much more, even a family physician.
Yes, thank you. As you know, I'm from a small town in the countryside, Comerío. It's in the center of the island. It's a rural area. And I grew up there having as role model family physicians in a community health center. They manage all the age groups in my family, my grandparents, my siblings, my parents, and everybody was there taking, receiving healthcare services, and that was an inspiration. I love it, the way they treat us, and it was fascinating to that they can manage all the family. So from there, I was good in sciences. I like biology. I went through college, through medical school, and I end up being a family physician with that inspiration and role models.
Did you ever think that you were going to go and work in a small community, like, the inspiration that you had from these other doctors?
Yeah, well, that was the reference, right? And for family physicians, the natural world is the community health centers and the ambulatory setting. So in a way, yes, you can be prepared to what life brings you, and the road that that you will take, because it was surprising for me that very soon after I graduated from family medicine, I received an offer to be a medical director in a federal qualified community health center, and that opened for me like a specialty and a new world of learning administrative functions, managing other peer physicians and multidisciplinary teams. And that took a road that I never suspected. I never thought about becoming an administrator in the healthcare industry. But, that's life. It was very interesting. I learned a lot in that position.
Did you have an opportunity before becoming an administrator to do health, direct patient care?
Yeah. I did direct patient care for more than 20 years. I combined the two functions, but I learned very soon that, first of all, the burden of the work, and I needed to decide, for one path. But yeah, I did primary care physician in many settings for more than 20 years.
What was your favorite population? Because you were inspired by these doctors who were taking care of your family. I'm imagining you as a child, right? They were your like the pediatrician role and as a family care provider, and then your adult parents, and then your elderly grandparents. In your case, what was your favorite population to treat as a physician?
Well, although I'm not a geriatrician, but my program was very focused on geriatrics, and we did a lot of training in geriatrics. And when I went to the community that I started, there was a lot of elderly people needing care, and doing house calls with elderly people and their family was great. I love that part of my job and that time in my career where I ended up my clinic in the office and went to the community and see patients at their homes, and they were waiting for me with vegetables, and I'm very happy to see me, and I enjoyed that. And that remembered me my community in Comerío. So it was a rural community, San Lorenzo, and we had a lot of patients, the elderly population. So I would say that was my favorite part of my job.
Well, I have to tell the audience here, because most of our audience comes from a mainland USA. And coming from Puerto Rico, the care is somewhat different, right? In medicine, we know the basic medicine, but the relationship that you have with your patients is somewhat different. A lot of people will come and they're grateful. They're grateful for the time that they spend with you. Unfortunately, the system is such that they have at times to spend hours waiting to see the physician, and they come very early in the morning and they bring all this food to the doctors that they plant. So they truly have organic foods that they bring to the doctors. And it was such a special thing. So I cannot imagine even going to their homes where they're going to receive you. They're going to probably have, the house is going to be, just super clean because the doctor is coming. The house is going to have some of the family there waiting for the doctor, probably. I can imagine, because they haven't done that type of work. And they're going to have probably some soup cooked, or something's going to be cooked that they're going to be offering, or some dessert, something like that. Tell us, is that how it was? Am I just imagining too far?
Exactly that. Exactly that. I took 2 pairs of shoes and clothes because I knew they wanted me to go to the garden and pick up, fruits and vegetables with them as a gift, and that was great, because that opens another relation with your patients and the community there. And I went there and prepared a vaccination campaign, for example, for the children of the community. And they were there, so being a family physician in the rural area and this community is great. But again, I started growing in the administrative world, and I saw the opportunity to take care for more people than one-on-one in my office. I got to the point that I had the responsibility for quality care, quality improvement initiatives for 600,000 members, for example. And when Maria came and when the disaster came, the hurricanes and all that, I had the opportunity to do things, to improve their quality of care, improve their quality of life from a different position. And that was also very important for me. And also learn a lot from the system. And that's where I am now.
That's quite an impact because guys, he's talking about 600,000 members to this healthcare organization in Puerto Rico. At some point there have been around plus minus 3 million people. So we're talking about a significant percentage of the population that you've been responsible to take care of, directly and indirectly through this work. So thanks a lot for that work. Tell us about before we get into a little bit of details of the things that were done during that position, the hats, right? You have the physician hat, and then you have the administrator hat. And as you say, you never thought in a million years that you're going to be an administrator, and then here you are, so eventually actually taking care of 600,000 people. When you change these hats, between taking care of your patient face to face and then the administrator, where you have a completely different set of language and other skills, and that they didn't really tell us necessarily in medical school. And then you see these other doctors who just they're not in the administrative side. What would you tell somebody who's thinking about or who's been offered confronting an administrative position that they will need, that they should look for, that to make that experience better for them as an administrator versus being a physician?
Yeah, I think the physician part is always there, and it's good because you're not a bureaucrat that have only grown in administrative part and never seen the community suffering, the community needs, your patients' needs, and their families' needs. Now that we're talking so much about social determinant of health, we see that firsthand as physicians. People having problems with literacy, health literacy, inadequate transportation to get access to healthcare, housing insecurity, food insecurity. So when you have seen that in the first hand and you're making administrative decisions, that's a different point of view. And also, we know we are scientists and we are people that we like to understand things and study. So I dedicate a lot of time of getting knowledge in the administrative world, financial education, administrative human resources, and even systems, IT. And again, another turn in my career is that I'm dedicating a lot of time for the healthcare IT world that I never thought, but my career took me through there. And the way I use technology to improve healthcare and improve quality of life and improve compliance and be more efficient, and even getting a higher ROI from the practices or the provider side. That's also very important. Technology and digital innovation is very important for us as physicians right now. And I would say that education in this new world, combining your knowledge and your sensitivity as a physician with your how you deliver care and making it happen, for the better of your provider, your peers, and the patients.
That's something that's important because they tell us, as physicians, oh, you're going to be the leader here and you're the captain of the ship and all this stuff. And then you go to the administrative world and there's so many people working there. You have your position, that you're going to have, but there's so much that you have to respect. You have you have set of different captains directing their own departments, and you have to learn to work also in those areas and acquire that knowledge that we really don't acquire in medical school. So you spend not only medical school, you also spend, as you say, a lot of time learning about these other things, which took you to this period in Puerto Rico's history, the Hurricane Maria. And right after Maria, then you had the opportunity to service these communities in such a much greater depth. Can you tell us a little bit about the projects that you had during that period of time that made some great, a great impact in the lives of these patients?
Yeah. Well, first of all, going through all those complicated times in the island, we lost a lot of physicians. It is different figures in the industry, but it is said that we lost about 9,000 physicians since 2014, and for different reasons. Physicians are getting older; they are retiring. The migration of young graduates to the States, and they stay there when they complete their trainings. The reduction in training programs, the change in demographics. We have a low birth rate or fertility rate, and people are getting older. So, for example, for pediatric specialties, it's very difficult to have a mass of and critical volumes to sustain the practice. Well, on the other hand, you have people that are young and need specialized care in pediatrics, but they don't have the appropriate offers, so the access is difficult. So that combination, you need to be creative in developing business model and access model to this population. And now again, we start learning so much about the social determinants of health and access to care and the importance of that. And I say that, one of the most rewarding programs that I developed is not in the industry, it's not in a health plan, it's not in my practice, it's in a community organization, in a non-profit organization, understanding how access is impacting the community and the people in the community. So, the last program that we developed is in a non-profit organization, in a community-based organization, helping people access care and the appropriate time, the appropriate access, the appropriate services at the right time. And we develop community workers, community healthcare workers, non-clinical staff, non-clinical people. We develop the curriculum, we develop the training, and we are basically creating healthcare navigators for the community and helping them access care adequately. Those are the type of things that are fulfilling for me, and that I'm working. Imagine that we're putting now technology on top of that. We're putting patient monitoring, remote monitoring system. We're putting secure messaging for the patient. We're putting systems to manage data that is coming from the Puerto Rico Health Information Exchange, and that we can work in interoperability and having data from the patients to manage them early and do preventive care in another way. All those things are since I'm working with different people that are very intelligent, more intelligent than me, obviously, and we're creating very nice things for the population. That sense of problems and difficulties drives creativity and drive innovation. And with the support that we're getting from the IT system, the digital development that we're having right now, you can do very nice things.
So what I hear you saying is like, we have big, huge challenges in Puerto Rico. And from there, you're switching from, what I see that you're doing is because it's needed, instead of continuing a reactive medicine, you're changing into preventive medicine. And not only through the physicians, you're adding extra care that can help the physicians that are left in the island to help prevent, so that there's less patients who are needing the critical time of the physicians, correct? Hey guys, I'm laughing here because as we're talking about changing the premises in Puerto Rico from a reactive system forced by the natures of what's happening with the limitations that there in the island, and then into a proactive and preventive system. And the electricity and the internet just, briefly stop for Dr. Ortiz, which is, we're laughing because it's a common issue in the island. The resources really are, the infrastructure is really failing. And this is not a new problem. And these are the things that they have to juggle as physicians, as people who live in the island, as administrators, and being so creative. To put into perspective some of the things that are happening, for example, I was listening or reading amongst our group, there's this large town in Puerto Rico with a large renowned medical center that only has like 2 OBGYNs, for example, for this population. And yes, the birth rate is falling, but there's people who still need care and they don't have access. The same thing with neurosurgeons. And then as administrators, you have to juggle, like you don't have people to service. So then you have to change. And not having physicians and then having these challenges, like you have facilities that you have to run, and then suddenly you don't have access to the electricity or to the internet services that you're trying to use. So that's why, we're experiencing that in our podcast right now, as an example. So tell me about, I'm sorry, so I just can't get over the electricity. Tell me about your nonprofit that you have right now. You say that IT, and you have people who are much smarter than you. Where do you see this going? Do you see this like as a project that is going to become a something that other companies and other healthcare organizations are going to be acquiring?
Yeah, well, I think it's the 21st Century Cures Act, that and the final rules of that. The final rule of that.
Electricity is back.
Yes. And the final rule of that law is increasing interoperability, where we can share patient information, and that will create and open many doors to improve care, provide quality of care, compliance, make the system more profitable even, and because the reduction of waste, the reduction of fraud, waste, and abuse, the improvement, reduction of duplicate tests, for example, will create, another world to improve efficiencies and improve quality. And that is happening in Puerto Rico. The Puerto Rico Health Information Exchange started in the last couple of years, and is connecting basically all the hospitals, all the laboratories, all the radiology centers. And that repository of data will increase, will be available for the patient, and will be available for the providers. And that will create another opportunity to improve quality of care. So I see it in the States and in Puerto Rico that technology opportunity increasing. And we as a physician, we need to learn to work with that, working with the EMR and getting that data, interoperable data, and use it to improve care for patients. On the other hand, we have, and you mentioned the difficulties that we have in Puerto Rico, we have truly disparity issue in Puerto Rico in the money that we get for healthcare services. And that's something that we need to address as a government, and the relation with the United States and with healthcare officials in the States. Because that creates that disparity at the end of the day goes down to the patient. It goes down to the quality of care that we can offer to the patient, the technology that is available in radiology, the technology in the hospitals, the technology that physicians can use to provide care. So that financial disparity is very important to close it and to improve the reimbursement that we get in Puerto Rico. And let me give you some statistics for the podcast, because when you understand the level of disparity, you understand some of the problem that we have in Puerto Rico. We have 41% less premiums for Medicare Advantage 41% than the national average. We have 37% less premiums than the lowest state, that is actually Hawaii. And we have 23% less premiums than the U.S. Virgin Islands. So with that, we need to comply with all the regulatory requirements. We need to comply with everything in the same in the regulations and the Medicare Advantage programs, and we have lower reimbursement. So the money is not there. It's not coming to Puerto Rico. It's not coming to the industry, and that circle back to the quality of care that we can provide. And still, we are doing great things. All the health plans in Puerto Rico are 4.5 or 5 stars. That means that we're doing quality of care as primary care physicians, as physicians, and the patients are getting, their gaps in care for chronic condition closed, and they getting the care. But the access is suffering, and the technology to provide that service is suffering. So the patient is not getting the best care that they can. It's the same for Medicaid. We are in a fiscal cliff right now. It's recurring. Almost every year we have that problem with financing this important program that it managed 1.3 million people in the island.
Almost half of the island.
Exactly. It's in the Puerto Rico Medicaid program or the Puerto Rico government health plan. And that creates a burden to the commercial side. There is almost 800,000 patients in commercial products or having commercial health plans because access problems, okay? Because the provider wants to increase their salary and their premiums that they get for procedures, but someone will pay for that. So the private coverage will increase in cost. So it will be very difficult to acquire a private health plan because it will be so expensive. And the whole system
unless the whole island was doing private, then you have a bolus, of income for that insurance to be able to survive and provide for the others. But otherwise, if half of the island is getting Medicaid, it's not going to happen.
And then we have such a large penetration of Medicare Advantage. Puerto Rico is the highest, has the highest penetration of Medicare Advantage than any other jurisdiction in the state because it makes sense. People need what Medicare Advantage are offering right now. That is good coverage and extra benefit. For example, dental, eyeglasses, hearing aids, and that's important for the people.
Doing the lawn, they do the lawn. They give them money for the supermarket, and they also give them money for their pets somehow.
Yeah, that's more recent. That's more recent that is CMS approved those benefits, to cover for social determinant of health, and it's been very attractive for the market, obviously. And but if you use those services appropriately, I think you can get a return of investment in quality of care. For example, if people need transportation, that is not part of the benefit. To go to the church or to go to a supermarket and they can get food, you don't have people with food insecurity, right? If you can get transportation to see your family members, you are not that lonely, and then having behavioral health problems. So if you use the CMS approved those services for a reason, and it's because we understand now that social determinants of health are so important. If you use it only for marketing and not getting the services to the people that need it the most, that's a problem. And CMS is working with that.
So then that's the physician maybe mixed with the administrator talking about all these things, in terms of healthcare and how to get those services to the patients. As a physician in Puerto Rico, to give a little background to the listeners, most physicians own their practices. So they're all, a big percentage. I don't know what the percentage is. Maybe you can tell us about that. They're small businesses, unlike the mainland, where most physicians are, for the first time in history, they're employed. So most physicians in the island are they're not employed. They have small businesses. They go from medical school. They don't go to an employee position. Historically, they've been just opening their shop or maybe joining somebody else, but in more of a partnership quality. So tell us about how the physicians are dealing from an entrepreneurship point of view, with their offices and all these challenges that you've said about managed care. How can they survive with all the requirements, the paperwork, and everything that managed care is requesting from them? And then, are they like seeing higher volumes of patients, especially because there's the physicians in the island, the amount of physicians in the island is much less than it was before. And how do you think the quality of care to those patients is being affected?
Yeah, well, because of that, everything that we mentioned in our conversation, the demand exceeds the offer. So the burden is there whenever you come out and start your practice. As you said, many physicians are small business owners in Puerto Rico. And we don't get trained to manage people, to manage processes, and to manage systems in the business. And my recommendation is that, first of all, the most important part that I have seen my 20 plus years of experience managing medical groups and working with physicians is that there is an error that they don't start with the right foot managing the revenue cycle, for example. And the revenue cycle starts with you being credentialed and being contracted the right way with the payers. And when you get out, you don't have someone to help you there. So you lose time and money because you're not credentialed in the health plan, you're not contracted. And if you add that the lack of the time that these organizations are taking to complete your process, that we will have a burden for you financially and and the way that you can access and provide services. Well, the second situation that I have seen in my experience is that primary care physicians are having problems in getting in the contracting in medical group. You need to understand, 80% of the Medicare population in Puerto Rico is in managed care. 100% of the Medicaid population in Puerto Rico is in managed care. And the commercial side is behaving like a managed care environment. So you need to understand the managed care world, and you need to get it fast, because if not, you will have problems, getting people in your office, billing, collecting, and making your business successful.
Is there an organization or somebody helping doctors do this in the island, learn this before as they're transitioning from medical school into their own practices?
There are people helping, physicians getting credentialed fast, getting the contracts right on the first time, and connecting them with large medical groups, because the organization in managed care is the patient is part of a physician panel, right? The physician is part of an IPA, an independent physician group, or a small MSO, and then those have contractual agreements for doing managed care with the health. That's the world here in Puerto Rico. So if you don't learn that fast, you will have problems in the initial phase. And adopt digital solutions. We have a large group of primary care physicians that are not adopting EMR because the digital transformation is coming so fast. Those physicians will have problems, okay? Because you are getting behind what is going on in the industry, and nobody can stop the digital evolution. You need a good EMR that can connect with the Puerto Rico Health Information Exchange, and you need to start doing interoperability, and that's in benefit of the patient, because at the end of the day, you will provide quality of care that is better if you're not connected and doing interoperable medicine with the transition of care, with closing gaps in care. Okay, and developing your own staff in the medical practice, in your practice, customer service, quality of care, compliance with the regulatory agencies and what is required by the managed care organization or the health plans. That's important because if the whole staff is not aligned, you will have a gap and you will have issues with patient satisfaction, which is so important now for star rating. You will have issues with doing what the health plan requires in your contract. Okay, if you all the staff needs to be aligned, and you need to dedicate time to educate them.
So that's a long list to have to somebody who just came out of medical school and not understanding the business side. Like, yeah, especially with the way that the island is so dependent on managed care and all the requirements that they're going to have. So if you're going to be a physician practicing in Puerto Rico, regardless if you're starting or not, there's a list of things, based on our conversation right now that we would recommend. First, number one, get an electric plant. That's number one. And that's seriously, like I know people personally in my family, they go to the doctor and then the lights are off and then that's it. After waiting for so many hours, you don't have access. But seriously, you have to have access to that. Number two, you have to know the system, right? So much managed care. So if it's so much managed care, you're going to have to credential with these companies early on. And then plan for having all these processes for quality assurance in place, good customer service, having personnel that's going to be dedicated to process all these things effectively in your clinic. And if your specialty is in, if there's little of your specialty, prepare to handle huge volumes because the island is really in need. Specialists like are not available that much in the island. So as a physician, as an entrepreneur, if I'm going to start my medical office, are you aware of any entities that are more friendly towards physicians? Because this is going to need a lot of capital for that physician who's opening this office. Are you aware of any, especially like our banks really helping doctors? The government, I know they had like that 4%, but now they're not approving anymore any other physicians into that 4%, correct?
Yeah, that was an important attempt to help physicians, as to stay in the island. That will evolve. It's close, but I think that will evolve in some way because the prices continues. But the banks are, that's another thing. Nobody helps us through the medical school to prepare a business plan or a business proposal to the banks. And so I would say that early on you need a good CPA firm or a good CPA. Not your friend, the friend of your friend. Look for someone that is specialized in healthcare, and get someone that is specialized.
Unless they do, right? Unless the friend of the friend is really the friend that specializes on healthcare.
Yeah, but not. That's not the only qualification. You need to look for that they specialize in healthcare, and then you look for people that really understand the revenue cycle, the billing, the collection, and help you get credentialized and contracted. And there are people that are, and you can ask, you can look for reference, and that if you're a specialist, you should look for someone that has a panel of physicians that they are working with that is in the same specialty that you, because they know they have been through that, they know the stepping stones, and they can help you in the process. So I will say a good CPA firm with healthcare experience. I will say a good organization that does billing and collection with experience in the managed care environment and with your specialty. And I will say, start early on with a good EMR and the implementation of a good EMR. The brands are known in Puerto Rico because they are most prevalent. They're functioning. Different specialties use different EMRs as a preference. And that research is part of what you should do with your people. Mostly billing and collection people can help you with that because they know their panel, they know their physicians and their clients, and they know what they're doing and the best practices. and then recruiting the appropriate staff for your practice. As you say, most of them come in sharing with established organization, but that doesn't mean that the ones that are established are doing the right thing. And
Yeah, they might not have the EMR necessary. They might not really, they might have a lot of people like in collections because they didn't know how to access that earlier and stuff like that. I have a question about credentialing. Normally here in the mainland, it's like 3 months to credential on average. When you start, and credentialing, to those who don't know, who are starting, basically it's like you submit your papers. Yes, I'm a doctor. And then the insurance is going to say, okay, yes, we're going to cover your patients when you start practicing. And then you can charge us for those services. How long does it take? Is it taking 3 months? Because when you're opening a practice, that's very important. You have to understand that you're not going to be charging, you're not going to be getting any money until you're really credentialed. And some of the insurances, you can go back for the time. They're going to allow you to be seeing patients, even though you're not credentialed, and they're going to pay you retroactively. But some of them might not.
There is variability. We have had challenges with some payers with different specialties, and that has many reasons. But I think the main reason in Puerto Rico, which is such a controlled, small environment in terms of relatively talking, we don't have as physician a centralized organization that we can submit our credentials, close the gaps if there is any credential that is we need to renew, and get it from there. So that's called a CDO, right? A credentialing organization. So each plan is requesting the same or different credentials. And you need to dedicate so much time getting reminders and getting appointments to submit using different platforms. Each one of them has a different portal for you to submit credentials. So that becomes such a burden to the physicians. And we have been working with that with physician organizations to create a CBO, and the government actually is moving forward with some ideas that will help. When I say the government, is the government health plan, again, that aggregates so many people and so many providers in the network, that if something is improved there, we will benefit from that. And I think the government is taking a look at that, because it's a constant complaint from the provider networks about credentialing. But you're right, there is variability, and we have had challenges. And the other thing in managed care, you see how some payers decide that they will close networks. And that's incredible for me in Puerto Rico, because we have such a limitation and such a needs of physicians. And deciding to close a network in any particular region, for example, or of any particular specialty, is difficult to understand. And those are things that are in discussion right now in the public opinion here in Puerto Rico. And I think health plan will do better analysis what they're doing, and that will change in the near future.
So we've talked about all these challenges and things that can be done to overcome these challenges if you're thinking about a practice in Puerto Rico, a physician, because most of them are going to be small businesses practicing, and you need to be ready for that. Why would someone do that? Right? It's passion. It's passion because you love the island, you love the people, you want to be there. Most of our physician friends, if you ask, like we are in this chat, that for our medical class, and it's a passion to be with their families there. They built their lives there. They don't want to leave. This is them. This is identity. So you have to understand that point of view. And this is you. If this is you, like you have the passion for the island, you have to understand the challenges so that you can survive as a physician. And you're going to be an entrepreneur, most likely, because you're going to have your office, and you have to be ready for these things. So now, Eddie, you've been working in so many, wearing so many different hats with through all your career, and now you have also developed a career as a painter. Tell us about that part of your life.
Yeah, since I was a child, I like to do drawings and painting in watercolors. And about 8 years, I started taking classes again. and I'm painting in oil and acrylics, doing prints, and I have done several collective exhibitions. And last year I did my first solo exhibition in Puerto Rico. So yeah, I love it. It's my way of calming myself and getting peace and reducing the stress. I don't see it as a hobby. I see it as a part of what I do also. And I'm dedicating a lot of time and effort to learn informal studies, uh, knowing people in that area. So very nice. I'm enjoying it.
Tell me what your family tells you about your painting hat.
They like it. They didn't like it when I didn't have a studio. So I have my home, my house as a studio. And now that I have a studio, they like it more. But yes, they like it, and they share with me the passion. And my daughter is a painter also.
So, what's your favorite thing to paint?
My favorite things to paint is nature, landscapes, um, trees. That's I think it's my background in biology and my background from the countryside and my hometown, right? But I do still life. I do other things, but mostly are landscapes and nature. Yeah.
Let's think about that young Eddie back going to see these family physicians who were taking care of their parents and their grandparents and grew up to be this doctor who has been able to influence so many thousands, hundreds of thousands of lives in an island, in a small island that he loves. Do you think that little Eddie would, in a million years, thought that they would be where they are and even painting and being related to all these people? And what other dreams do you have that you haven't accomplished yet?
Yeah, no, never in the world. I would suspect that, growing up again in a poor rural community with a poor family, illiterate family. My granddaughter, my grandmother was illiterate. She couldn't help me with the school. My mother was working all the time. Um, the community was not prepared to help, children that were looking for new opportunities. The school was not prepared to do that. So, getting with the right people helping me to evolve and get to college, the first one in my family, and get the degree and being here, doing what I love, taking care of people and painting and helping others. You know, we are in our early 50s, and I think there's so much to do that I can help my community and my peers. That I look forward to continuing this, for example, in this digital evolution, because I truly believe that there are many solutions there. So that's my vision. My company is working on that. My people are working on bringing solutions to Puerto Rico to improve quality of care. And I'm focusing on that. I think the next 10, 12 years will be incredibly life-changing for patients and providers in terms of technology. And I want to be there.
I remember I have this vision of we used to stay, we had what we call La Casita. And La Casita was that little house where four of us would stay, my roommates when we were going through medical school, very close to the medical school. And I always have this vision of Eddie walking down the street in front of our casita with his backpack. We all had backpacks, I was just walking as students in front of a casita and saying hello or goodbye to us or whatever it was. And never in a million years would we had thought that we would be in these positions that we are today. So it's very emotional, very sentimental, and I'm really happy that I've had the opportunity to be your classmate and friend for this time. And I'm very proud of what you've done for the island, really trying to combine the hat of being a physician with that of the administrator that has to be so, fiscally conscious and putting everything together and being the orchestrator for this systems in Puerto Rico. So thank you very much. Thanks for being here. Any final words of inspiration to anybody who wants to practice medicine in Puerto Rico?
Yeah, we talk about many challenges, but I think the opportunities and the satisfactions are far more than the challenges, and that we can do a better work, that we can do, we can help our communities, our people, our families, and we can improve the healthcare system together. So let's keep working. And thank you for this podcast. I have listened, and I invite everyone to listen. There are many inspirational stories there that we can learn. And thank you, Myrdalis, for the time. And have a great weekend.
Thank you. You too. Have a great day. Bye.
Bye-bye.
One more thing before we go, we want to know how to get access of Dr. Ortiz. So how can they get access for your medical, your professional aspect, and also for your painting, which is also professional, but the painting aspect, not the medical aspect. So tell us, where can people reach you?
Well, my company, Community Healthcare Leaders, is an LLC that I have in Puerto Rico, supporting administrative processes and doing administrative solutions for providers and healthcare systems. They can contact me directly, Ortiz at chlpr.com. And my Instagram for the paintings is Eddie Ortiz 955. Eddie Ortiz 955.
That's EDDIEORTIZ 955. And the email is C as in cat, HLP as in Paul, R.com. Ortiz at CHLPR.com, right?
Thank you. Yes.
Awesome. So you guys, if you want to get a hold of Dr. Ortiz to talk more about how to do your practice in Puerto Rico, work with IT, and develop programs to help the island, he's available. And if you want to take a look at any of his wonderful paintings, you can go on Instagram. So thank you for being here.
Thank you.
Well, guys, that's it for today. Stay tuned for more of our Design Your Physician Life podcast, which was brought to you today by our Maxillary Mastermind, which is really a personal and professional development program for physicians who want to learn entrepreneurship. We will continue to bring you useful resources to develop your physician entrepreneur life, like we did today with Dr. Eddie Ortiz. You can actually find him, contact him at Ortiz, EORTIZ at CHLPR.com. And his paintings are available on Instagram. You can check them out at Eddie Ortiz 955 on Instagram. Thank you for joining us. We hope you had a great time as we did. Stay in touch with us. Visit our website, maxallure.com, MAXALLURE. Please don't forget to subscribe, like us, give us 5 stars, and share the love with your friends and family. See you later. Thanks. Bye.
Please remember that Design is not providing specific financial, medical, or career advice. Our only intent is to stimulate your appetite for growth by sharing our experience and those of our speakers, coaches, and guests. Your personal growth and success will be unique to your circumstances and your hard work. We sincerely hope you enjoyed the show and look forward to seeing you next week.